I'm with Tifenn Humbert, who is at the WHO, World Health Organization, Regional Office for Europe. She's here presenting a new World Health Organization report on the regulatory framework for community pharmacies in Europe. Tifenn, tell us what this new report is about, please.
The WHO European region is a very diverse region because we are covering 53 countries. We are covering EU countries and non-EU countries. Therefore, the legislation on community pharmacy is very diverse. And we thought it will be very useful to have an overview of what countries and how countries are regulating the role of community pharmacy in all those countries. And we decided to do this report. The report will facilitate countries and member states when they wanted to review the law on pharmacy, on community pharmacy, the law on medicine, to show what other countries are doing and maybe to take some options about what to do and how to do it.
The report highlights some expanded roles for pharmacists in some countries. What's the WHO position on that?
So WHO is promoting universal health coverage, and we know if we want to reach universal coverage in all the country of the region, we need to involve other health workers and medical doctors. And we are working on the Astana Declaration, which is promoting the role of other health workers and nurses and pharmacists. So we thought that the community pharmacists are an important player to reach universal health coverage. The community pharmacists are trained, they have education, and they are open many days during the week, and they are very accessible for patients, so they can provide many services, preventive services like vaccination for adults. They can also recommend patients how to take the medicine, and there's also an important role with antibiotic resistance, because pharmacies should not dispense medicine, antibiotic without prescription. So we thought there is an important role to be played by community pharmacies in advanced services to reach universal health coverage.
So, in the area of regulatory reforms, recently FIP worked with WHO, collaborating on consultations on reforms in Lithuania and Montenegro. How helpful is that kind of collaboration work in this area?
So some member states contact WHO because they were willing to change the community pharmacist law and the legislation. Therefore, we thought it's always good to bring countries together to share the experience. We contact FIP because you have a lot of member states and you have a lot of experience, a lot of the reports done that are evidence-based on what are the best options for countries. We organized in 2018 one workshop in Montenegro and another workshop in Lithuania because both countries are facing some challenges. One of them is the distribution of pharmacists. So the current legislation in both countries is not specific about the distance between pharmacists or how many population need to be covered by community pharmacists. So we bring countries like Malta, Hungary, Poland, and FIP to share with us those experience, because countries like to hear about best practice from other member states, and it's always useful to ask questions and clarification regarding what are the implementation needed.
Talking of implementation, what are the WHO's plans to implement and follow up this new report?
So as you know, this new report is one of the first one covering this topic. So for us, it was very important achievement because a lot of countries has been asking us, and we managed in this report to cover most of the countries of the region, EU countries, but also Central Asian countries. So we have a lot of information. We had a lot of reference. So it's a very comprehensive report with a lot of information and reference that other member states will be able to use. We are planning to translate it to Russian and to French in order to disseminate it in other regions. And we are also promoting this report in many different events, like the FIP conference today in Ankara.
Tifenn, thank you for sharing this new information with us. This is Linan Wang reporting for FIP.